COVID-19, equality and inclusion blogs. Transgender individuals have had a history of being discriminated in almost all aspects of their lives, including in employment, healthcare, and general social interaction, among other areas of lives. This means that even before COVID-19 pandemic, the transgender community was significantly disadvantaged. COVID-19 may not be transphobic, but its outbreak has significantly amplified the discrimination that comes with transphobia. Transphobia is defined as a phenomenon and ideas that involves negative actions, attitudes, and feeling toward transgender individuals. It is basically the intense prejudice against individuals that are transgender, which result to their discrimination and harassment. The focus of this blog is to evaluate the impact of COVID-19 on the application of discrimination resulting from transphobia towards the transgender community. The audience for this blog includes the government, employees, and the society at large. Blog 1. Impact of COVID-19 on the application of discrimination in relation to transphobia. In the event of crisis, the existing inequalities are often amplified. According to Reid, the economic and social hierarchy that predict COVID-19 have been reproduced. The less privileged LGBT, especially the poor and those from minority groups, have been experiencing significant discrimination and violence more than ever before. Consider that they are now closer and have no way to hide from the communities that do not approve of them, and may have been chased out of their homes, while others do not have any home to go to and they end up in the hands of the police, who brutally arrest and harass them. In other occasions, transgender people are unable to get the protection they deserve because their express identified or their identify document do not protect them from abuse. This made them afraid to go out to get anything from store during the lockdown and curfew. COVID-19 has also amplified discrimination of transgender when it comes to healthcare and medical provision. Even before the pandemic, the healthcare system across the world were not friendly to the trans community. The outbreak of COVID-19 only made this situation worse as trans people are experiencing healthcare and medical discrimination more than ever before. Trans people are being deprioritized when it comes to receiving COVID-19 medical care, such as assessing ventilation. According to Korean It and trans people may transfer from work under during as a result of the pandemic compared to the general population, considering that they have more vulnerable and have high medical risks that most medical providers may not be willing to focus on. Worse still, the fact that most governments such as U.S. Trump administration removed LGBT healthcare federal protection in June 2020 made the medical discrimination during the pandemic more visible and intense. This is not me. Many trans people are unable to access medical care as priority is given to cisgender patients. COVID-19 has also amplified transgender discrimination within the society. which has led to a rise in mental illness among the transgender community. This pandemic usually to a rise in unemployment, leaving most trans individuals without jobs and having to move back to the community that do not improve of their sexuality. Most trans people lost their job or receiving pay cut considering that most work in the casual and informal sector. This left them with the option of moving back home to survival where they are abused and discriminated. PSB research group found out that in the United States, 30% of LGBTQ community had their salary decreased and their work hours reduced, against 22% of the general population. Further, the transgender community has a minimal trust or reliance of assistance in health and food aid agencies like WHO and Center of Disease Control and Prevention places them at risk of mental illness, such as there has been a rise in mental illness and suicide cases among trans community. COVID-19 has resulted to a case where trans people are more exposed to the society that discriminated, which leaves them mentally unstable. United States Nation 2020 indicates that the measures taken in addressing COVID-19 has significantly increased the discrimination and inequality. For instance, the criminalized law existing in the different nations that usually make LGBT people to be more vulnerable to discrimination and abuse by the police in the context of curfew and restriction to movements. Moreover, as they contribute to the significant the pandemic by staying at home, trans people often find themselves exposed to family members that are usually unaccepted for their sexuality. This leads to cases of discrimination and are exposed to emotional and physical abuse, which lead to depression, stress, anxiety, and other mental issues. Basically, the restriction and curfew that came along with COVID-19 placed transgender people in situations where they exposed to situations where they are discriminated. Other aspect of transphobia discrimination is that transgender individuals are often too afraid to apply or do not qualify for government COVID-19 transpose benefit. This creates a discriminatory barrier that hinders them from accessing any benefit as they do not have documented incomes, legal gender recognition, or tax clearance. This is especially evident for sex workers in the transgender community, of which such jobs are not considered legal. It is also very hard for transgender in some countries to access financial aid to assist them survive the pandemic, which makes their survival harder. This kind of discrimination makes transgender individuals economically disempowered, which drives them to serious mental, physical, financial instability. Overall, the transphobic discrimination and inequality experienced by the transgender community as a result of COVID-19 pandemic disproportionately raise their risk to the factors associated to its impact. The restriction to movement and the lockdown that have happened to prevent the spread of disease also increase transgender people exposed to discrimination from people who abuse and violentism, such as their families who do not support their sexuality, police, or the society at large. Additionally, loss of job or pay cuts, lack of legal protection by necessarily agent, and poor access to health care due to COVID-19 have intensified transgender physical, social, emotional, and financial stability, pushing them to mental instability. This transphobic discrimination has resulted to a high level of depression, stress, and suicide among the transgender community during COVID-19 pandemic. Essentially, the outbreak of COVID-19 has amplified and intensified discrimination toward transgender community. COVID-19 has increased the prevalence of transphobia, leaving transgender people more exposed to the risks that they have always been fighting against. This impact of COVID-19 pushed transgender people towards the threat and the risk of transphobia that they have always tough against, making them more mentally unstable and vulnerable to discrimination. Block 2. Impact of COVID-19 on the application of discrimination in relation to transphobia. There is nothing transphobic about COVID-19. However, its impact has significantly amplified transgender people discrimination, and especially in places where their human rights are not prioritized. The discrimination against transgender people increased significantly after the outbreak of the disease, as most of the impact pushed expose the vulnerability of the trans community. Even before COVID-19, transgender community was struggling with the transphobic discrimination, and the pandemic only made it worse. The pandemic impacted the economy, social interaction, and health care made discrimination against transgender people more evident. The focus on the blog is to evaluate the impact of COVID-19 on the implication of discrimination resulting from transphobia towards the transgender community. The audience for this blog includes government employees and society at large. First, most trans people who are mainly working in the informal sector lost their jobs or had pay cut, putting them to financial troubles. This forced them to move back home or to communities where they are discriminated for their gender identity. Others who had been driven away from home for being transgender found themselves either financially constrained or homeless without anywhere to go or anyone to give them assistance. Secondly, the health care system in most nations do not provide trans people with easy or non-discriminatory access to health care, regardless of their high-risk health issue, making it harder for them to access medical care during the pandemic. Thirdly, most governments across the world do not give enough protection to transgender individuals against a form of discrimination, which exposes them to abuse and violence from police and society during the pandemic. All these transphobic aspects coupled together amplified a far much worse situation for the transgender people during COVID-19 pandemic, causing them emotional, physical, and financial pressure. This pressure results to high level of mental instability, leading to high rates of mental illness and suicide among the transgender community across the world. Essentially, COVID-19 presented a high condition for the application of transphobic discrimination, which has led to serious adverse impact on the transgender people lives mentally, financially, socially, and physically.